Thanks for making yourself available for this meeting. I'm going to switch us over to, oh, yes. This meeting is being recorded, so anyone that's not able to be on the call today or wants to replay it can do that. There'll be a recording and a copy of the PowerPoint on our website. I am going to go ahead and share my screen. Let's see if I can do this. And I have, as many of you know from previous meetings, I'm going to do my best to stay connected. My internet sometimes has an attitude, so we're hoping that doesn't happen. We are going to do, sorry, let me get back to my here. Today's meeting is really meant to be an introduction. It's not going to be a substantive meeting. We're going to be scheduling the substantive meetings to follow, but we want to go through introductions. We want to know who's all part of our group. We want to talk about topics. And then we want to talk about what meeting schedule works best for everyone. So we're kind of going to go through, and we'll go through ground rules, but we want to cover the basics today, and we expect that that will take up most of today's meeting, and then we'll get started on our actual substantive topics at the next meeting. This group is really intended to cover broad topics that are relevant to Pcrp providers. We started with a group, you may have heard we had another advisory group that just finished meeting, and that was specifically, it was a group of attorneys and case managers, but specifically to refine the practice principles. So it had a very specific, finite purpose. Like I said, this group is broader. Now that we have 10 counties on board with Pcrp, we've had questions and challenges that have come to light, as you can imagine, and we've sort of been keeping a running list of those, and it became a fairly long list, but some pretty significant themes developed. And so what we have come up with for proposed topics are those more significant themes. But we definitely want to hear from you all if there are other things that you want to see on the agenda. You may also know that there is a separate contracting model enhancement work group. Billy Strelo from our office has been leading that. I know we have at least one Pcrp provider that's part of that group. And they are in the process, they've met several times. They're now in the process of finalizing recommendations that will go before our commission. And so I will certainly be sharing that at a future meeting once we have finalized recommendations. As we expect those, those could certainly impact Pcrp, and we're trying to keep between the Pcrp contracts and non-Pcrp contracts, we're trying to keep as much consistency as possible. Some differences make sense, but we do want to be as consistent as we can. So we expect to schedule a handful of meetings over the next several months to discuss and then hopefully resolve some of these current challenge areas. And then we'll probably take a break, meaning we'll address the topics that are most relevant right now, and then at least for the next contracting cycle, and then we'll take a break, and then we can hopefully reconvene this same group at a later time when other challenges surface, or we can always form a new group if that makes sense, but that'll be down the road. So the only other thing I want to say before we get to introductions is obviously participation in this group is, at the meetings is strongly encouraged, obviously not mandatory. If you're ever in a situation where you're not able to make the meeting, but you want, another attorney or a case manager from your county to attend in your place so that your county is fully represented, reach out to me and we can certainly do that. And as I said, all meetings are being recorded and will be available to everyone afterwards. So let's go ahead and do introductions. Most of you hopefully know me. I'm Caroline Meyer. I'm the program analyst for the Pcrp. And I've been with, I'm pretty much the full-time support for PCRP now. I've held a few different positions in this office, but I've been with OPDS since 2001. So I've been around for a little while. And I'm happy to be here, happy to help lead us through this process. And I will turn it over. Let's do that. We can do OPDS staff first, and then we can go around. I guess I'll have to see. We might just do what the other group did, which was just choose the next person you want to introduce. So Karen, go for it.
Hi, everyone. I'm Karen Farkas. I am the current PCRP manager. I'm assuming most of you received my email this morning that I'll be transitioning out as of next Friday. I'm happy to be part of this conversation today. And, you know, internally, we've been thinking about the importance of getting feedback on these areas from you all. And so I'm excited that the conversations will be starting and can inform the program and contracts moving forward. I'm not going to be a stranger, but I'm listening in. Go Caroline. Okay. And Gloria, I'll tap you now.
Hi everyone, my name is Gloria Vidal and I am the data person for PCRP. I'll be attending these meetings to take notes so I can do a qualitative analysis of what you guys are saying to capture the themes that will help us understand the direction we'll go in after the advisory group is over. So thanks for having me. And I actually don't know, are there additional OPDS?
Alina.
Okay, Alina.
Hello, everybody. I am an executive assistant here for OPDS, but I have done a lot of work supporting specifically the PCRP group. So you probably you have received emails regarding these meetings, and yeah, I'm kind of here behind the scenes to help make sure everything's going well. So nice to meet you all if we haven't already interacted.
I'm really glad you introduced yourself, Alina, because Alina does send all of our, she's been sending all of our invitations out. She does a ton of work behind the scenes for PCRP. So she's a great resource, and I'm really glad you've all had a chance to meet her. We can just, now that I can see all the participants again, before I was just looking at my big screen. So Ryan, I'll just call out people.
Sure. My name is Ryan Loosely. I'm down in Roseburg. I've been a private investigator for 9 years, and so I've worked with as a vendor for OPDS in that role. And then in the last year, I took a contract with the Arneson Group here in Roseburg, a law firm, to do part-time case management. So I used to work for DHS for 17 years prior to doing this, and so I'm excited to be part of the committee and to be able to contribute.
Great. Melissa?
I'm Melissa Riddell. I am a juvenile practitioner, so an attorney in Lynn County, and I've been the administrator of that juvenile consortium since 2011.
Great, thanks. Stacy?
Hi, I'm Stacy Lowe. I'm also an attorney practicing juvenile law. I've been doing that exclusively for the last almost 14 years. Been doing public defense work my entire career, and I am currently the director at Southwestern Oregon Public Defender Services. So I'm also excited to help steer this program and make it the best that we can.
Great, thanks, Stacy. Judah?
Hi, my name is Judah Largent. I use he, him, his pronouns. I'm a juvenile attorney practicing out of Benton County with a handful of cases out of Lynn and Polk counties. I'm also the OCDLA Juvenile Committee co-director.
Great. Warren?
Hi, I'm Warren Brune. I'm employed at Quad Valley Public Defender in Roseburg. I've been practicing almost 24 years now, or will be as of the end of this year. Been at UVPD for about 12 of those 24 years. been practicing juvenile, mostly dependency, some delinquency for the last 17 years. Did about 5 years of criminal defense along the way as well and before.
Great. Amy?
Hi, my name is Amy Miller. I'm the Executive Director at Youth Rights and Justice in Portland, and I've been here I was here as a lawyer, and now I've been here in this role almost 3 years. And my pronouns are she, her.
Great, thanks. Kyler?
Hi, I'm Kyler. I still have my Zoom background up for when I was Zooming with a 4-year-old yesterday. I forgot to take it down. I'm a practitioner attorney in Multnomah County, and I wanted to introduce myself. I have to step out for a few minutes for an all-staff meeting that was called at MPD, but I wanted to introduce myself before I disappear and come back, but I'm happy to be involved.
Great, thanks. You did let us know that. I appreciate that. Dana?
Hi there, I'm Dana Brandon. I'm a case manager administrator for the Pcrp group, and have worked in that role since we rolled out this program in Oregon in 2014. Aside from that, I've worked with juvenile public defenders for the majority of my career. So thanks.
Gardner?
Hello, I'm Gardner Ashmanskis. I work at Multnomah Defenders Incorporated in Multnomah County. I am the juvenile supervising attorney, and I've been here about 20 years or so. And most of my experience was in juvenile dependency and termination of parental rights, but some criminal background for about 5 years, like some other folks here, before I started juvenile work.
Thanks, Gardner. Jillian?
I'm Jillian Rivas-Davila. I am a case manager in Columbia County, and I started when the pilot program came out there, and I've also worked providing direct service to families involved in the juvenile system for about 12 years.
Jody?
Hello, everyone. My name is Jody Russell. I'm the case manager in both Benton and Polk County for the Pcrp group. Before I took on that role, I was in charge of NRE cases through Benton County. So I'm happy to be here and to see the work that we can all do together. So hello, everyone.
Great. Shannon?
Hi guys, I'm Shannon Getman, and I am the other half of the case manager administrator with Dana Brandon. I've been in this genre for about a little over 20 years, started with DHS, went to the DA's office as an investigator, and now I am very, very lucky and fortunate to be part of this program. Thank you.
Michaela?
Hi, I'm Michaela Avery. I'm one of the independent Pcrp case managers here in Multnomah County. Most of my experience is working with children and adults with intellectual and developmental disabilities for the last 10 years, and I'm happy to be a part of this group.
Great. Nicole?
Hi, I'm Nicole Thomas. I am a Pcrp case manager in Yamhill County. Started at the beginning of this program in 2014. Background before that is many years in social work and mental health, a lot of direct service with youth and families, going all the way back to Christie School after college. So it's been a grip of a time. I'm very excited to be on this group. Thank you so much.
Thanks, Nicole. Paul?
Hi, everybody. I'm Paul Aubrey. I'm an attorney. I'm doing juvenile dependency and delinquency in Columbia County. I've been out here about 11 years, and I have really found the Pcrp to be an amazing model, and I can't wait to make it even better and work with y'all. Thanks.
Great. Paula Lawrence?
Hi, I'm Paula Lawrence. I'm not turning on my camera because I am homesick today, and you guys do not want to see me in my pajamas, I'm thinking. But anyway, I practice juvenile law with the Pcrp out here in Yamhill County, and we're one of the original counties. And aside from that, I've just pretty much worked in just about every area of juvenile, criminal, both adult and appeals and PCRP. So anyway, I'm hoping I can contribute in some way to this committee.
Thanks. So I think that's everyone that's showing up on my screen. Is there anyone that we've missed? Great. So as you can see, we've got a really nice cross section of our PCRP counties. We tried really hard. We weren't able to include everyone that expressed interest, but between the two groups, we really tried to have good representation of both attorneys and case managers in the counties, and so that was our goal. And hopefully we've achieved that. The only other things I wanted to share about OPDS leadership, we do have, as I'm sure you all know, we've had lots of open positions. We have done some recent hires. We have a new deputy director. His name is Brian DeForest. We have a new finance manager, Ralph Amador. And then Autumn Shreve will be joining us very soon as our new government relations manager. Yes, you've all, sounds like, received Karen's email this morning. We're obviously very bummed to be losing her. But as she mentioned, Shannon Flowers will be taking over as the interim. So we really hope to be able to continue without, with very little change in the, obviously it's a change, and it's, we're going to be losing Karen's expertise, and but Shannon's been a part of the program. As you know, she was in charge of our resource, the resource portal that we have. So we're excited to have her back and be able to get back to updating that and making that available for all of you. And then she'll also be stepping in as the interim in Karen's role. So let's see here. Oh, on the executive director, the only thing I'll say about that is we obviously we still have an interim director, Ed Jones, but the commission is moving forward on the recruitment process. And so we do hope to have more information for, we'll share that once we know more. So let's go over, let's talk about ground rules. Oh, sorry. Talk about objectives first. So the objectives for this group are to identify the PCRP juvenile contracting challenges and the needs for improvement, to engage in OPDS attorney case manager provider conversations to explore issues and refine the program contracting model accordingly, and then to refine and update the PCRP programmatic components for the upcoming contracting term. As most of you know, we are in the process of creating extensions for all of your contracts. We're going to be getting those out. Some of those have started going out today. We'll be getting those out over the next 2 weeks. And that will extend your current contracts from December of 2021 through the end of June 2022. And so the discussions that we're going to have in this meeting will help inform the new contracts that would start in July of 2022. So our ground rules are pretty basic. We obviously want, we want everyone to participate actively, speak individually, be candid and respectful of each other, keep focused on the topic or question, and we'll do our best to help with that. We want active discussion, but it needs to be limited to these meetings, and really we're not, because of the public meetings rule, we're not allowed to have conversations over email. We can send out notices. We can certainly talk about details of the meeting in terms of timing and all of that, but substantive discussions need to happen in the actual meetings. And then OPDS staff will try to keep our conversations, our comments to a minimum. So our goals for today's session are to review the proposed topics and issues to be explored by this group. As I mentioned, we're not going to be going into substantive conversations today, but we do want to talk about what our topics for this group should be. And we're happy to talk about additional topic areas that you may all have, and then what information we need to engage in the conversations. And then if possible, by the end of today, if we can actually finalize those topics, that would be great. So in terms of the actual topics, one of the primary challenges that we have had, and you know, again, we've kept a sort of a laundry list of things that have come up, but one of the most challenging issues that we've had to address is complex case weighting. And is it too complicated? We sometimes feel like it is, but you know, of course, we'll want to get your input on that. Is there a way to streamline the system while still capturing the variation in the weight across case types and within particular cases? And then what information do we need to engage in a meaningful and problem-solving conversation around this topic? Potential subtopic, this is essentially a subtopic of the case weighting, is post-disposition representation case weighting. What is the scope of representation? What are typical activities in and out of court involved in effective post-disposition representation? Does our current system of case weighting, the 0.5 except for complex, appropriately capture the workload? And then again, what information do we need to actively engage in this problem-solving conversation? Feel free, I was just going to say, if anyone has any questions as I'm going through these, I see Melissa looking like you want to say something. Feel free to just chime in. This is meant to be informal.
So I want to clarify something. So where it says the post-disposition representation being 0.5 except for complex, that's referring to delinquency or both dependency and delinquency?
Delinquency.
That's what I thought. So I just wanted to be clear
Yes.
about what we were talking about that. Because that changes, I think, the subtopics and things like that.
Thank you. Now I
Yes.
can breathe.
Yeah, me too.
I was going,
Sorry.
oh my goodness.
Sorry, we should have clarified. Yes. Yes, that means delinquency. And then, so again, those two sort of go together. Another really big one that's probably right up there with the frequency that we get, you know, questions about complex case weighting is the pre-petition representation. What is the scope of pre-petition representation? We've certainly had attorneys ask us to reconsider our position on this. And so again, we want to talk about, you know, the definition, what process systems need to be developed for pre-petition representation to be facilitated and supported. And then again, like with the others, what information do we need? Another one that really came up as a result of our last work group meetings is better understanding the role of the case manager.
Amy
Yes.
has her hand up. Amy
Oh,
Miller.
hey, Amy, go ahead.
Hey, thanks. My question was about the pre-petition piece. And I can't remember what the phrase was on the slide, something about the current guidance or the current decision-making framework. Is that available somewhere? I didn't know that there was a working eligibility determination. Is that something that it would be awesome to be able to see that?
Yeah, I mean, it's essentially when we respond to requests, it's what we have provided. It's similar to what's in the contract language. It's pretty basic, but yeah, we can certainly provide that.
Oh, shoot, I gotta take my hand down. Thanks.
Okay, so back to the case manager role. It became more evident to us as we were discussing how to refine the practice principles for case managers, that some attorneys really didn't have a clear understanding of the case manager role. And again, that was a bit concerning to us because, you know, we want everyone to understand the role. And so we realized that this would be a really great place to have a broader discussion about that role. because it goes beyond just the understanding and refining the practice principles. You know, there are questions around the role of case manager versus staff. There were then conversations about the differences between case managers and investigator roles. So definitely something we wanted to put on this agenda. And I think, yeah, those three were the primary off the long list of topics. And I'm happy to sort of run through some of the other topics we had on that list. But I'd like to hear from all of you first about other topics you'd like to include.
Could I give one?
Certainly.
I work in a rural county now. I think I worked more years in Hillsborough. By the way, shout out to Paul. I haven't seen him in a few years. I mean, one of the issues in less populated counties like this is having enough providers to distribute cases to. Even though almost all of our criminal defense consortium providers jumped over onto PCRP, we still don't have enough provider offices because of the way it's traditionally been contracted here to provide all the juvenile services on dependency cases, because we need so many different attorneys a lot of times. So getting attorneys from out of county, that's a challenge for distance, for being able to ever see people face to face. It's a challenge for the judges. Well, one judge at least would really like to have another office or two to distribute cases to, and I don't know if PCRP and OPDS is taking a look at that on a county by county basis to see if the number of different offices is adequate.
Thanks. That's helpful, Warren. This has been a bigger issue in terms of coverage. I would say it's not just limited to the rural counties, although I do think rural counties have their own unique set of challenges. Part of the problem that we've discovered in PCRP is as new counties have rolled out to PCRP and their attorneys have gone exclusively to handling either just juvenile or just criminal, is we don't have, before where you had criminal attorneys who might not handle a regular juvenile caseload, but they might still be available to handle a few conflicts within their group. We have found that having that sort of, cross coverage within the same contract isn't as available as it used to be. So we have, we are having to do some unique things to get cases covered. But I'm happy to add that to the agenda, because I do think coverage generally, we have a situation right now where we're asking many of our PCRP counties to provide reciprocal conflict coverage, and that has worked really well, but it's not a contract requirement. And so one of the things that we have found is that, it becomes challenging to expect that coverage to happen in every case. But I will say where it is, where PCRP providers have been willing to provide that coverage, I think it works really well for the courts. And it obviously works well for us, and it helps some of our PCRP providers whose caseloads might otherwise be down. It helps them meet their contract quotas, more effectively. So I'm happy to add that. Do others share that concern? I mean, obviously I want to add topics to the agenda that are of concern to the larger group. So I would be interested in hearing from others.
Caroline, this is Melissa Riddell. I think that is a concern in a lot of places, and it could be a concern in Lynn, depending on how numbers fluctuate and things like that. And so I think it is a valid thing to discuss, because I think tagging along with that kind of goes with the need for providers, qualified providers that are willing to do this work. And I know that that's a different conversation, but I think it affects contracting in a large way, because if we don't have a sufficient pool of providers that are that meet the qualification standards, then how do we draw more providers to do the work? And then the only other topic that I thought of would be capacity and availability considerations that need to come into play when we're looking at caseloads and the number of attorneys that are necessary in a particular area. Because in order to have sufficient coverage, like for shelter hearings that you don't find out about till that day, you need to have a sufficient pool of people that are available to kind of have that rotation, or it makes it extremely difficult for anyone to meet their other contractual obligations, like visiting child clients, and to have those other case-related meetings that we all have, if you have to cancel them continuously or everyone's tied up in a shelter hearing.
Okay, yeah, that's a really good point. And that was part of your concern, Warren, I think, was not just having enough attorneys to handle the caseload, but really having enough different different contractors where, to handle all the different parties in the case at a shelter. And we've run into that in a couple of counties just recently, where we're having to really dig deep. I'm not sure who had their hand up first. Was it Jillian?
Yeah, I had just wanted to kind of highlight back to the out-of-county attorney to kind of, if we're going to be looking at that, just to kind of also look at the how useful, making sure that those attorneys are aware of the ability to use case managers and how perhaps prioritizing that some of those cases have the access of somebody local to like a case manager to be working with.
Great. Yeah, that's a great point, Jillian. I mean, I will say the nice thing about having PCRP providers cover each other's, PCRP providers in, Yamhill covering for Polk and Polk covering for Yamhill is, and at least in one case, there's an attorney that works in both groups, the Yamhill group and the Polk group. So that's great. She knows both counties really well, but at least that all the clients have access to the same PCRP resources and providers, which is really helpful, as opposed to bringing in an individual attorney from out of county that doesn't even know what the PCRP is. They're not familiar. They're also not familiar with the county practices. So that's been a big plus. But yes, out of county providers do have access to the case managers in those counties. So Judah.
I was hoping we could talk about developing kind of an alternate resource system, since we no longer have, Shannon to work with as a juvenile resource provider to talk about cases with. Just my idea was people in counties that are geographically very different from each other, maybe developing some kind of system where you could have I could have a buddy out in Harney County and run conflicts and be able to do kind of case staffing and running through things and gathering perspective, since we don't have Shannon anymore.
Karen, I don't know if you want to talk about, briefly about, Shannon's role or the resource role, as it's still there.
Sure. And I'm here. And first, I think Judah's recommendation is a great idea, regardless of what OPDS offers, just that kind of community and more brainstorming. I think that's a really awesome idea, which should be considered. But I think in addition to that, I think Caroline wanted me to probably say that, there is intention at OPDS to add capacity, like juvenile expertise capacity, which will hopefully be replacing, that be filling that gap. So I think that there hopefully will not be a long gap of OPDS filling the juvenile resource space as well. So I think Shannon Flowers will be coming back in my role as the interim, but there'll be there'll be hopefully additional staff or with her or in addition to her to build those resources and be available for technical assistance. Is that what you wanted me to say, Caroline?
Yeah, no, that's exactly what I wanted you to say. That's great. And as, I guess we didn't really touch on this, but in addition to the transition with Karen's position and Shannon coming in as the interim, we do have recruitment open for 2 juvenile deputy general counsel positions. One of those being the position that Shannon vacated. So whether it's Shannon or someone else, we do expect to have that position filled and have that resource position back. So Judah, are you wanting that to, I assume you want to add that as a topic here, maybe ways to expand the resource?
I would love that. I think what I noticed with PCRP is, you know, we need a lot of different offices, but then you no longer have the benefit of staffing, or if you want to try something new and creative, you need somebody else to be like, am I brilliant or is this a horrible idea?
Great. Other suggestions for topics? So what I heard was expanding the juvenile resource statewide. And again, we can talk more about specifics of what that would look like. And then challenges in rural counties. Actually, I think what I want to call that is just, let's see, coverage. And Melissa, your comment was qualified providers.
Right. And I think it goes to capacity and availability. So when we're contracting, looking at all of those things, because to some extent, you need a wider pool of offices, like was discussed, but the number of offices that a county may need will depend upon the obligations within their county, right? So like, for example, Benton and Lynn have their juvenile dockets at the same time on the same day. So although it'd be very easy geographically for like Judah and I to, you know, have people do conflict cases for each county, it becomes very difficult when we're scheduling court hearings because we're both required to be available in our specific county at the same time.
Yep, that makes sense. Thanks. Stacy.
Thank you. I'm not sure if this is the appropriate venue to raise this, but I am working on doing a CLE, and one of the topics that it contained was parent mentors, and that's a program that we had here in Coos for a while that was super successful, and then we just lost the people who were doing it, and then the funding, and we're not able to get that rebooted. But I spoke with Jill Cohen. She's currently in Colorado. She says hi, Karen. And she sent me some stuff. I haven't had a chance to look at it yet, but she suggested reaching out to Karen specifically, and I thought the PCRP program might be a good place to look at how we might be able to utilize Title IV funding to get some more of those parent mentors in, especially here in Coos. We're having a really hard time getting and retaining case managers. And so this might be another avenue that we could get some similar support for parents to really help overcome what I see as a really big barrier at the beginning of cases that can sometimes make or break a case, and that is the anger towards the agency and the mistrust towards the agency. And so I've always thought that parent mentors are an excellent way to show that one can move through this process and be successful. So I wonder if that's not something that we could look into as well.
Sorry, Caroline, I'll just jump in. That's a great recommendation, Stacy. I think that is the kind of conversation that may be something that happens after the next contracting term, because we're limited and the LPDS was limited in their funds right now for this next contracting term. So that's certainly not something we could include in the next cycle, but it's something to think about as OPDS continues, like asks for their budget for the next biennium, like whether this should be an additional component and how to do that. So I think that's a great topic kind of to do, you know, later in the rounds of this advisory group. And
Yeah,
I guess, sorry.
Oh, I was just gonna say, I appreciate that too. And I'm happy to add topics. As I mentioned earlier, sort of the first round of topics we want to tackle are those that would likely have an impact on the next contracting cycle. And the idea is to keep it to a limited number so that we can, because essentially then I'll schedule a meeting to tackle each one of those subjects. And it may take more than one meeting for some. But it does sound like that's one that we might be able to, we'll certainly put it on the list, but it might be for like the next round of meetings. Paul, I saw you raise your hand.
Oh, yeah, I was just thinking that maybe we could re-examine the Oregon State Bar policies and practices for juvenile, you know, dependency and delinquency, and so that we know so that we, you know, when we're doing all these things, we know what we need to what goals we might want to look at or changes or anything like that. So if any, I have just one thought on that, but can wait till the next meeting. Thanks.
Okay. Yeah, I can put that on the extended list also. Anything else? And then, oh, sorry, Gardner.
Yeah.
Hi, thanks. Just a quick topic, my sentence would be the notion of examining the use of case managers and having an expectation that they would be able to be available for a higher percentage of our caseload. And I know that's, you know, it's not a new topic, but and I'm not sure if the advisory group is the right meeting or the case manager group is the better meeting, but I do know that the more we utilize case managers in our office on our cases, the more I realize there's, you know, really there's no end to the benefit of the case manager to their cases. And so it's really triage. It just feels like triage right now. And it's a shame. It's like, it's so good, but it's so limited as to how many cases we do. And I know that has funding issues and other things that tie into that and all that, but that's a topic that I, you know, just.
Yeah, no, that's a really good point. I will say it did come up in our case manager work group, the attorney case manager work group. Although it was a bigger topic than what was intended for that discussion. So it's certainly something we talk about the case manager role.
Yeah, I'll just
Melissa.
Oh, I'll just.
Oh, go ahead.
I was going to elaborate on that. I can't help but talk. That's exactly the conversation that we were hoping to get to in this potential topic, because I think that there, you know, and to really get kind of a spectrum of opinions, because I think that there's been some individual thoughts about whether, you know, right now there's a 1-to-1 ratio offered for staff, but the 15% for case managers. And so that if you look at it as like a bucket of money for PCRP, that could be flexed. There could be less staff and more case manager capacity. And of course, that would be something that we'd want to do uniformly. But that if you look at it as like, should we pay for staff or case manager with this bucket of money? I think that is an open question that can get input from this group. So exactly what you were saying, Gardner.
Yeah, I agree. Melissa.
So I was just curious, as we're talking about these things, to what extent, if any, will we have kind of the ABA workload studies and timekeeping study information? Like we're talking about case weighting and caseload, what constitutes a caseload? I feel like that's also something that if we're talking about contracting, is 80 cases an FTE? Like I think it depends on a number of factors, but I'd like that to be part of that conversation if we're talking about case weighting and how we develop a caseload, and those types of issues.
Yeah, that's a good point. I do know that we are expecting, we've actually been expecting the ABA study results for a while now, but I continue to hear that we're close. But I don't, Karen, correct me if I'm wrong, will they address dependency?
Well,
They'll
yes.
address delinquency.
They will address dependency and delinquency from a caseload perspective, not from a my understanding, not necessarily from a workload perspective. So I think there's probably going to be some analogous kind of, interpretation that can come from it. Again, neither Caroline nor myself nor Gloria has really any information about the ABA study, what it's going to entail and come out. But if it is, I'm sure it's something that can be incorporated. But if helpful, with regards to the 80 cases, there are two numbers that are like out in the world around juvenile dependency workload. There's an 80 and a 60. And I think that those are kind of the going workloads. Some counties, some jurisdictions wait, some don't. But I think maybe something that could happen, and in the conversation about case weighting, maybe there can be some literature shared about what does exist around where that number came from, because it isn't a number that the PCRP came up with. It was a number that I think in the ABA and in some other, and obviously we have Amy Miller on the phone who could probably talk about it more, but that comes from something.
Okay, we've got about 10 minutes left in the meeting. What I would like to do, if there's no other suggested topics, I'd like to just run back through the 3 that are on here to make sure that that you all, please speak up if you have thoughts about anything, any of the 3 that we've listed. Paul.
Oh, I'll just be frank. I thought we stayed on post disposition on sex cases because of the threat of registration for delinquency, but I didn't know we were supposed to stay on for all delinquency cases and help the client with their probation or their commitment. So I guess I feel like I missed something there. Is that correct? That we're supposed to stay on for all delinquency cases?
Not necessarily. Karen,
okay.
You want to?
Okay.
Well, I know if Stacy wants to answer, I'll let her answer. Stacy, were you going to respond to Paul?
Yeah, yes, you know me too well. So in Coos County, what we have started doing over the last couple of years is we are asking to remain appointed on cases where our client has requested it, or we have a relationship with our client such that we can assist in encouraging them to be successful wherever they're placed, whether it's on probation in the community or at a state training school, or where they have, significant mental health needs or developmental disabilities. So it's really on a case-by-case basis. And in some cases, I've found that I've remained on board and not much of anything has happened because my client has done fine and hasn't needed me. But then there are other cases where I do things like participate in all of the meetings that they have at Oregon Youth Authority to ensure, that I'm stayed up to date as to how my client is doing. I am still listed as their attorney of record, so there's no possibility that they are prohibited from calling me. I get regular updates from parents. And so that way I know even if my client hasn't reached out to me, maybe I need to reach out to them because there's an issue going on. And of course, then there's just periodic check-ins. So how busy you are on one of those cases varies greatly. And it's really just, what you think is appropriate for your client and what the court will allow. And hopefully I covered everything.
Thanks, Stacy.
The only thing I'll underscore in Stacy is that there is a standard of representation around post disposition on juvenile delinquency cases in the state bar standards regarding criminal and juvenile delinquency. So it is an explicit standard in Oregon standards of representation and in national standards.
Yeah, and so I should add, in cases where it turns out that it doesn't look like I'm needed, then I would move to withdraw in those cases for those same reasons.
Thank you.
So complex case weighting, post-disposition representation, pre-petition representation, and then the two new topics that we covered today. I'm happy to finalize the agenda for those topics if that covers. Now, again, this is not exhaustive of anything we've ever, wanted to talk about in PCRP, but it's the focus really is to limit the list to items that we want to address before the next contracting cycle. So I do feel like that this is a good list, but certainly open to comments. I do want to leave just a few minutes to talk about meeting schedule. So if everyone, unless there's other questions or comments about topics, we'll go to that. Whoop. Sorry, all over the place here. Okay. Is there a particular day of the week that works well? Tuesdays, Wednesdays, Thursdays. We usually try to steer clear of Mondays and Fridays just for obvious reasons. I know some people. Stacy.
This is Ryan. Oh, go ahead.
Oh, sorry. Go ahead, Ryan.
I have a firm meeting every Thursday, so Thursdays really aren't great for me, and noon meetings are fine though, so just another day.
Okay. Yeah, that was another question. Is noon, noon is typically our preference just because it avoids court hearings, important other meetings. Stacey.
So Thursdays are not good for Coos County either because we have permanency hearings scheduled on Thursdays. And so today I only had one and it was, a short one, so it was not a problem. But if there are multiples or they're actually we're having a contested hearing, often we will work through the lunch hour or at least during part of it. So I wouldn't be able to participate at that point.
Okay. What about Tuesdays? Paula, do you have a question or comment?
No, I was going to say Thursdays have always been bad for me. I was doing that for the other committee because that's when we have our regular consortium meeting. So if it could be anything but Thursday, that would be my vote. And Tuesdays would be fine.
Okay. And we may or may not be able to always do the same, like the second week or the second Tuesday, third Tuesday. I will say November is going to be a little tricky because I am out from Veterans Day through that following week. So November 9 is probably, which I think is a Tuesday, might be the only date that works for me in November. Does that work for others? We'll do a meeting in October as well. We'll schedule monthly meetings for now. So we could do October 12th, which would be the second Tuesday. And then November 9th would also be a second Tuesday. Does that work? And how do people, I think we'll skip December, again, for obvious reasons. We'll take that month off. And then what about January 11th? That would also be the second Tuesday. So we could start with those 3 meetings. And I can ask Alina to get those out for everybody to put those on your calendars. And then we'll also finalize the topic agenda and get that out. Anything
Could you give us those 3 dates again?
Yes, it would be October 12, November 9, and January 11. And then again, we can go from there. We'll, we probably will need to schedule a couple more meetings at least. But, and who knows, by that time we may have, the ABA study, we'll certainly have more updates about OPDS leadership in terms of executive director and whatnot. Michaela, do you have a question?
Yeah, the PCRP has an all-county staff meeting on Tuesdays, but I can't remember if it's the first Tuesday of the month or the second Tuesday. If Shannon or Dana could jump in.
It's the first Tuesday, so we're good. Nicole asked the same question, so. But yeah, we're good with the second Tuesday is fine for this group.
Perfect. Okay, well, oops, go ahead, Paul.
Oh, and I would just say those 3 topics that we identified, just a single one of them and all 3 of them individually could take up an hour to discuss. There's so much to talk about.
No, I absolutely agree. And that's why I'm saying, I think if we can just get, these 3 meetings on the calendar, then, I fully expect we'll have to plan more meetings beyond that, but we can worry about that after the first of the year. We found that in the other work group as well. You plan for 1 meeting per topic, and some took less and some took considerably more. So we will just play that by ear. But I really do appreciate everyone joining us today. It looked like we had possibly full representation. I think Alan Reynoldson from Lincoln had indicated he wouldn't be able to join, but I really do appreciate everyone being available. I'm looking forward to working with all of you to move these topics forward. And in the meantime, you can expect, like I said, to be getting your contract extensions very shortly. Have a great day, everybody.
Bye, everybody.
Bye, everybody.
You.